All right, it's 12:30. I think we can get started. I know there'll be some more people joining, and a lot of people click on the link right at 12:30, and it takes a little bit to log on, especially if you have a Zoom update, which happens frequently. But welcome everyone to Project Echo Geriatrics. I'm Kate Bennett. I'm the medical director for Project Echo, a geriatrician over at Harborview in Seattle. And I'm really glad to have all of you here. Welcome if this is your first time coming to Echo, although I know a lot of you have been to many sessions already. If you can, just so we all know who's in the Zoom room here with us, you can introduce yourself in the chat. That would be great. Fosters a little bit of community. As we go through the session, feel free to put your camera on, even if you are eating. It's lunchtime for many of you. So it's pretty, everyone has to eat, so it's fine. If you can't put your camera on, that's also okay. I know some people are in places where you can't put your camera on. But anyway, welcome. We have a great session today. We'll run the session like we usually do. We'll start off with a short didactic, and we have a really wonderful speaker today, all the way from the East Coast. And then we'll talk about a case. And Dr. Fernandez submitted a really wonderful case for us to discuss all together. So I'll go ahead and introduce, thank you, Jesse, for getting us started on the introductions. Introduce our speaker. So Dr. Mallory Mcclester Brown is a dear colleague of mine over on the East Coast. She's a geriatrician at the University of North Carolina. She's the family medicine residency program director there. She is a wonderful teacher, has a geriatric academic career award, and has led a lot of geriatrics teaching and education initiatives, and is an expert in ageism and teaching about mitigating ageism. And that's what she's going to talk to us about today. It certainly comes up a lot in our primary care setting. So Dr. Brown, thank you so much for joining us today. And if you want to share your slides and get going, we'd love to hear what you have to say.
Absolutely. Thank you so much, Kate. It's a real pleasure to be here with y'all today and to just engage and enjoy this community. I've heard lots of really great things about this particular ECHO cohort from my dear friend Kate, and excited and grateful to be here to talk a little bit more about ageism. Share screen, bear with me for just a second. We will go ahead and get started. So we are here today to talk about a problem that I would argue that we all see on a daily basis, whether we're aware of it or not. This is happening kind of all around us, and I'm about to share some of the statistics and the facts about how that impacts our patients and the care that we provide. So hopefully by the end of this session, everyone will have kind of a baseline definition of what ageism is, also be able to acknowledge some of the risks of ageism and how they impact folks' everyday life, as well as the care that we provide to patients, and then have a couple of ideas at least about combating ageism after this session. So just to sort of set the stage and to start with a basic definition for us to work from, ageism is considered the discrimination that older adults face due to negative and inaccurate stereotypes. And according to the WHO, this is the most pervasive and socially accepted form of discrimination. And I think that we can all agree to that. And probably, even though we are here likely with an interest in taking care of older adults on this ECHO today, know that we have at some point committed some form of ageism. I myself have, and know that we'll get into some of the details of that in just a minute. Essentially, ageism kind of is this thought process that as we age, we become small, we're weak, we're invisible to society, and we become less useful. We aren't able to accomplish as much. Sometimes it's the belief or behavior that an older adult is burdensome, whether that's the belief about the older adult or the older adult believes that of themselves. It's the belief that everyone will lose their ability to be cognitively intact. And I think this is a really interesting example end quote, but if you took the entire view of what humans do from primetime advertising only, you'd see a society entirely without old people. When you're watching commercials on television, if you watch television, you rarely see older adults unless it's an advertisement for things like Depends or adult diapers. It's not about the things that we are attracted to or interested in necessarily in society. You don't pair those things with older adults. And I am sure that each and every one of us has been looking for a birthday card for a friend and run into any number of kind of silly, what seems like harmless fun in teasing folks about their aging. And this starts at 30, starts at 40, and it makes fun of folks for being older. These particular cartoons are run-of-the-mill, and you'll see them if you quickly do a Google search of old aging, if you're at the drugstore looking for a card, easy to find. There's 3 components to ageism, as there are to any of our biases, and these include the prejudice that we have toward older people, or essentially how we feel about aging. How, if you are the person, and I know I've been known to say this, of gosh, I'm getting old because my knee hurts from that run last weekend. That's a prejudice that I am showing or sharing in just my attitude around turning older and becoming a bit older in my own life. Our discriminatory acts or practices are what we put into play or what policy puts into play, things that law might overcome as well. And then we, of course, have stereotypes that are exhibited in those cartoons, in the way that we speak about older adults, and just how we think about aging at large. So I want everyone to just sit with their thoughts for a second, and feel free to use the chat if something strikes you, but what's an example of a time in your own life that you might have inadvertently exhibited ageism? And then I think the bigger question, the more important thing, is when's the time that you or your colleagues or someone that you've worked with might have approached a patient's care differently secondary to their age? And if anyone has an example that they want to include in the chat just to get the conversation flowing, that would be great. We'll take 30 seconds for that.
I think one powerful one that I think about a lot has come up in some conversations I've had before about ageism was in some of the worst times of COVID, when we were talking about, quality of life and frustration around certain people doing well and other people not doing as well, and older people recovering, but younger people not. And there were so many emotions and feelings tied to that. And I think there was a lot of ageism that I know I myself also felt and participated in during that.
Thanks so much, Jesse. I think that COVID really brought this out in spades and made us, particularly those of us that deeply care for older adults and think about this a lot, really aware of it. And with that, I'll show, I think this is becoming more of a topic of conversation. While it's still the most acceptable form of discrimination, it is something that people are thinking about a bit differently than we might have even 3 or 4 years ago. Thanks so much. So I think this is just in line with what we've spoken about, but a fairly recent study in June of 2020 was published showing a cross-sectional survey of more than 2,000 Americans in that age range 50 to 80. And they used the Everyday Ageism Scale, which is a really nice 10-question, pretty straightforward, validated study to take a deeper dig and see how folks might be experiencing ageism. So this particular scale looks at interpersonal interactions as well as internalized ageism, and then ageist messages that individuals might receive or come across in their daily life. And over 80% of those 2,000 people in that age range experienced at least some form of ageism. So this is exceptionally prevalent in our communities and our society. And from that, they were able to extrapolate some data that essentially shows that, as you can see here, as people's as people scored higher on the everyday ageism scale, they had worse health. Their physical health worsened. We saw more chronic health conditions in people that internalized and had ageist beliefs that were shared with them. We also saw that their mental health was probably worse, and their depressive symptoms increased as well. So we know that this is prevalent, and we know that this is harmful. I think this study does a really nice job of showing that. Next slide. But the good news is that, again, I think while the pandemic has been exceptionally horrible for many of our older adults, and we've just seen a wake of ageism occur and really come out during this time period, it's also brought up this conversation. And so there's, you Google and take a good look, you're looking in the news every day and you're seeing more and more headlines about ageism and how this impacts our patients, this impacts society, and that there is a real need to be thinking more about this. So one of my favorite researchers in terms of ageism is Becca Levy. And even going back to the early 2000s, she did work and published on this, that more positive views of aging really increase the outcomes and improve quality of life and healthcare. So this particular study was done in 2003, so quite a while ago, but really putting into play some interventions to turn people's ageist beliefs around. Those folks with better thoughts about aging survived 7.5 years longer. So that's really, I think, a really impressive statistic to show how the power of positive thinking about age can really turn things around. More recently, we have data to support that when put into play an activation activity to really consider and think about positive aging beliefs and to turn our minds, shift our minds into this direction, truly improves physical function. So at 8 weeks, you can just see this great improvement in physical function when people have undergone an actual behavioral intervention to improve their beliefs on aging versus those that were in a controlled study. So how do we combat ageism? There's a lot of different ways to do this. There are certainly ways that we can and should be lobbying to our policymakers and thinking about laws that prevent ageist actions, whether that's in the workplace, that's in things like how we rationed healthcare during the beginning of the pandemic. There's many, many ways that this can be done in policy and law, but where I have more control or more power and authority is in educational activities, and particularly in ways that we can increase folks' exposure to older adults. And so we've seen that by just talking about the actual norms of aging that can change people's ageist beliefs. It's bringing awareness to things that folks have generally believed to not be true. Like, it's normal to be depressed in older adulthood. That's not true. So bringing those that education into the healthcare field is really important, and into the public sector as well. And then we have seen even more so when we're able to connect intergenerational interventions where older adults and younger folks interact and bring education to that. That is when we really combat ageism. So wherever you have opportunity and space to increase exposure to older adults for your learners or other folks that you're working with or around, that can be really helpful too. So I wanted to just share one case and see what we can pick out of this that might be ageist. And then we'll go into just a couple of reframing ideas. So family medicine resident physician is seeing a 75-year-old female who's coming in for follow-up of her chronic conditions. During the visit, the patient shares that she is just old and falling apart. While myself as the attending is precepting the patient, the resident shares how much she just loves cute older adults and gives a clear plan for the problems that the patient had come in to be seen for hypertension, osteoarthritis, and hypothyroidism. But when I probe a bit about the patient's comment about falling apart, the resident's not really sure what to say or do. So I am curious what this group might pick out as ageist and how they might support their patient. Anybody?
I don't think
I
most
suppose I
people
would
would
probably-
appreciate. Oh,
Go ahead,
sorry,
John.
go ahead.
Oh, sorry. I suppose I would probably ask her, the patient at least, well, what do you mean by you're falling apart? And
Yeah, thanks, Jeff. So definitely first, like acknowledging that the older adult is showing their own internalized ageism to themselves. So asking them what they mean and sort of pushing back on that a little bit. And then Joanna, I think you had something to share too.
Yeah, the whole cute sort of notion, I don't think would sit well with most people at any age, I think, but we tend to let it slide more with older adults.
Yeah, thank you. That's something I wanted to point out and just acknowledge. I know myself, I've been known to say like this, frail 91-year-old is really cute. And one of my residents said it this week while we were rounding and caught herself because she knows I'm the ageism police. And she was really quick to say, I acknowledge that I think this person is wonderful and let me just change the adjective that I use. So I think that's really important too. But I think that this case is pretty run of the mill, and we as primary care providers just have a responsibility to our aging patients to truly just push back a little bit on what it is that they mean and trying to help them reframe aging. One quick thing in the chat. It sounds like you feel like losing function is inevitable. I love that, Helen. Talking a bit more to that and thinking about coping strategies and ways of reframing that you're not losing your function and you might have a heightened sense of other things and an ability to do other important parts of your life while some things might change and shift in your function. So the last point I want to make is just about language. And I think that in any bias, we know language matters. And so these are some phrases that are often used and have been acceptable in the past. But as we start to think about shifting away from ageism and combating it and pushing it back, using phrases like aged, gray hair, demented, the silver tsunami, which I know myself thought was really like a catchy phrase for a bit, but it's truly just othering our group of older adults. Even the word elderly, which has been around for many, many years, is really kind of, again, othering this population. And the other thing I want to bring up is that we often catastrophize words like this person is really struggling with their loss of function. This person is battling with cancer. This person is fighting against their cirrhosis. So making the end of life catastrophic is, again, an ageist way of going about things. So instead, really being strict to using older adults, older people, older person, and using inclusive language. We will all grow old, hopefully, as long as for some reason we are not catastrophically taken earlier on in life. And so thinking about it in that way, that this is a part of the spectrum of life, not something other or something that's not desired. And I think most importantly, celebrating the successes and contributions of all. I think as we age, we have the ability to be more creative. We have wisdom, we have history that we can share and might know the best way of doing something. And so I think celebrating that and really focusing on the beauty of aging can push back on ageism a bit. I could talk about this all day, but I had 15 minutes. And so I will stop there and leave this evaluation survey and turn it back over to Kate. Thank you all.
Thanks so much for that talk. It's really helpful to have a discussion about something that we see all the time and some concrete examples of how to change our behaviors. If anyone has any questions, you can feel free to unmute and ask them, or if for some reason you cannot unmute, you can put them in the chat. Any questions or even comments, things you've seen or wanted to bring up as examples.
I actually had a quick question. So I know we talked about reframing sort of how we see aging to make sure we're checking our ageism biases and like sort of helping our patients understand, like, you know, reframing their perspective on aging, but at the same time not invalidating like their lived experiences and concerns. I guess I'm wondering if you have any resources that you give to patients to kind of help encourage them to reframe their perspective on aging.
Yeah, I think that's a great question that I should be prepared for, and don't have a perfect resource for that. I think, you know, your point is so valid that we know that chronic comorbidities do have a tendency to increase over age. And so acknowledging and treating their medical concerns is one thing, but not allowing people this idea that I'm falling apart or that age inevitably means that I will be depressed and will have cognitive impairment. Sort of educating folks on what is normal aging and what is not can, again, sort of push back their norm of what aging might look like, and just be a helpful way of again, combating and treating this. I would recommend a couple of different resources if you are interested, not to direct patients to, but just in terms of your own reading and your own education. Elder Speak is a kind of has been around a little bit longer. It's a book that has some great resources in it. Becca Levy just wrote a book as well that I think it's called, I'm gonna pull it up really quick, sorry. I have lost the title of that, but Becca Levy just wrote a book that's really great and helps to rethink the words that we use as well. And so this is all kind of in terms of our own education, but I don't have a great resource for older adults to go to and start to read to turn their own mindsets around.
Thank you.
Carrie.
Hi, Mallory. Thanks so much for being here.
Thank you.
So I joined a little late, so I'm sorry if you mentioned this, but like Dianne Feinstein in the news for her sort of like age and now what appears to be developing dementia and comorbidities. How can we, like, as, you know, primary care docs and advocates and healthcare providers sort of play a role when these topics come up in the news and politically and with our friends and family?
Yeah. I mean, I think that's kind of why this conversation started so boldly, is the article that says I want to die when I'm 75. Like, that is when ageism blew up in our faces, right? And so it's kind of acknowledging it and just having open dialogue and conversation about the fact that everyone ages differently, and it doesn't mean that we will all be old and can't hear and can't see and have urinary incontinence. It means that we all age at our own pace and speed and gracefully, and sometimes less gracefully than we might hope. But that we don't have to just make assumptions about anything in this life, right? That we should be pushing back on that and thinking about age as each individual goes through that. So I think it's just another one of these things that we have to have open dialogue and conversation about as primary care doctors, in supporting people in the space and the place that they are, and not making assumptions and biases. Does that help, Carrie? Do you have any other great ideas and expertise?
I think that's like, it's just, you know, the most, you highlight like the most important points, I think. It's just super tricky when, you know, we now start seeing like impacts on, I mean, it happened with Ruth Bader Ginsburg too. It's like, we don't want to be ageist, and we also have to acknowledge that some people do age with different challenges that may impact the work they do. And so we can't assume it, but so it's tricky because we want to be like anti-ageist and also realistic.
Fair. Right. Yeah. I mean, I think it's not fair to put a blanket statement on that every like 55-year-olds can no longer be like effective salespeople. That's what my husband and I talk about a lot, or that our country can't be led by more senior adults. But I think there are certainly realistic expectations that we all have, and that might be at 30 and that might be at 85. It's just hard to, a number like that number does not necessarily limit people. It just depends on when and where, how we physiologically age, not necessarily numerically.
Yeah, thank you so much. Thanks for talking about this important topic.
Thanks, Carrie. Good to see you.
Any other last thoughts or questions?
Just something minor that a dermatologist, I'm trying to bring my video up, told me during a dermatology rotation was calling SKs barnacles. There's a number of patients that thought it was funny, but then I also saw patients that were, you know, they didn't, I think one compared themselves to a whale and you could tell they were offended so even simple things like that.
Yeah, I think, I mean, it doesn't have to be this big broad change, but just correcting people like we do for other microaggressions, to change the language in the script, because barnacle is so offensive to you and I as thinking about that. And so, yes, some patients might think it's funny, but others might not. And it's just a simple language change that can really make a big impact to improve our older adults' well-being and mental health, if nothing else. Thank you for bringing that up. Thank you so much for this opportunity. Happy to answer any other questions or engage any other dialogue by email. Thanks, Kate.
Thanks so much for joining us and answering our questions. It was a great talk. We'll send out to everyone some of the resources, some of the links referenced in your talk, and links to the book and a couple other resources on ageism to share with everyone. Thank you so much. You're welcome to join us for the rest of the session, but I know you're busy and it's the end of your day on the East Coast over there. So whatever works best for you is fine with us. We're going to move it on to our case discussion.